questions, please? We've got a few minutes.
Alex Muller from North West Anglia Foundation Trust. Again, really great presentations and a lot to think about. I feel a bit what's the word, bamboozled, I suppose, about the fact that it's still more sustainable to have Coke from a plastic bottle. And I think with the sustainability managers, the challenge we have quite a lot is knowing when something is truly sustainable, because there's so many, just listening to your presentation, Melissa, there's just so much data that goes into one element of something, of one product. And it's just really complex. And I think it's I guess it's more just a comment really, just how complicated it is, and to know what the right direction is sometimes, because you were saying about sometimes if you're doing something for CO2 benefit, it might not be a plastic benefit. So how do we find that happy medium, I suppose?
You'd like me to answer that, wouldn't you? The reality is it is complicated. It is, but people are working hard to try and work that out. Does that make sense? We're knowing more. We know more than we did 10 years ago. Do you know what I mean about it? And it depends. There are certain things. So it's interesting, when you work with the waste, has anybody ever heard the term fugitive waste at all? Has anybody ever heard that? When you work with waste management people, litter is called fugitive waste. Does that make sense? So what we want to try and create as many closed systems as we can. So that's the very basic thing we need to do. Anything that we use, coming back to what you said there, at the very base of the outside circle needs to get back in the system to close that loop. So in very simple terms, closing the loop is a start. Does that make sense? And then if we make sure that we're closing the loop, we can make assessments and judgments, and they are possible to do. Does that make sense, as to whether glass is better than plastic or whatever? So our basic thing, going back to the Ellen MacArthur model, if you like, is to try and close this loop. So again, we don't want waste getting mixed up so it gets contaminated, because then it can't be recycled. All those sort of things matter. So if we can make sure that we're closing the loop, that the things go where they're supposed to go, coming back to it, absolutely, and we all see that in our own places of work where things don't go where they're supposed to go, and all the rest of it. Our bins do what they're supposed to do, and the waste goes where it's supposed to go. You're giving yourself a chance before you then move down the cycle, your circles. Does that make sense? And giving yourself options, and that would be my advice, and yeah. Is that helpful?
Yeah, no, it is. Thank you very much.
Can I ask a question? What is the big driver to single-use items in healthcare? Why has it exploded as it has?
Well, it's been pushed a lot by industry. So.
Is that to make money?
Indeed.
Yeah. Because interestingly, it's a similar thing. I just talked about recycling. Recycling against reusable, it's the same issue in actual fact. There's money to be made in recycling now, in actual fact. And one of the tensions is against reusing things is actually the economics of recycling is a thing. That makes sense, But there's money to be made to selling more of these things rather than creating a reuse. So that comes back to frameworks and economic frameworks for it. Right, okay.
I think we have to remember how much actually ends up getting recycled as well.
Yeah,
Not a lot.
No.
Yeah. Just coming back to your point you made, there's definitely a prioritization framework from a health technology perspective. So there's enough data out there now for us to be able to prioritise where we need to focus our efforts in terms of optimising the use of health technologies. PPE is a big one. And there's a lot of different tools that NICE has to be able to support optimising the use of PPE and where it's necessary, and giving the green light to healthcare professionals to not have to use PPE at certain times. Often it's not required, and again, there's this sort of potential risk, this cultural acceptance that they should be wearing gloves or aprons or, you know, single-use curtains, which is absolutely crazy. So we have enough data now to prioritise where to focus the efforts to really have a lot of plates spinning, so optimisation, but prevention of use, you know, along the continuum of how that health technology is used, and just optimising its use along the circular economy pathway.
Thinking back to one of the early sort of it's Amelia from UKHSA. I remember back in the days of BSE and prion fear, that seemed to be the first big thing in surgery where we started just ditching a lot of the reusable kit that had been sort of turned around repeatedly for years and started pushing towards single use. And that seemed to be the first sort of tipping point to moving towards so many single use items. Do you still get that sort of messaging? Is that still something that people come back to you and say, oh, well, we don't sort of trust the CSSD processors? Is that still something you hear, or is that ancient history now? Over.
Yeah, it often comes up, and you speak to global leaders who are surgeons, and they will just shoot it down because the sterilisation and decontamination protocols and, you know, the processes that are followed in the UK are so stringent, you know, it's just not a viable argument anymore at all. So, yeah, there's a big weight behind reusables across surgery. I mean, I know a surgeon who doesn't use gloves when he operates. He's incredibly intelligent and very knowledgeable about sustainable healthcare and works very closely with Jenny Lewick, is at the IPC, a professor infection prevention control. So think of that what you will. Just throwing that big one in there, but it's just really changing that culture eat strategy for breakfast, right?
Hi, I'm Marie from University Hospitals Birmingham. Just a quick question on the, you showed some pictures of the recyclate that you'd taken out of the surgery.
Yeah.
Was any of those plastics tested at all to see what sort of polymers they were?
No, there weren't, but it's a great point, yeah. I was limited, the limitations of that study was the time and my resources available to...
I did something quite similar with our theatre.
Okay.
I asked them to remove the what they deemed as recycling before the patient came in.
Right.
And we had some of the plastics tested. We found that some of it was like polystyrene, but it looked like PET.
Right.
And some of it was mixed materials, so the machine couldn't even recognise what it was.
Right.
So that is another barrier that we have in the industry, unfortunately, as far as I'm concerned. So.
Yeah, no, absolutely.
And if any of you have got anything to add to that, you know, from your perspective.
Well, that seems like healthcare packaging is way behind food packaging,
Definitely.
is what I would say in that.
Yeah.
Because, as you know, as you'll see on the shelves, there's been big pressure to create recyclable plastics. And as I said, I mentioned in mine, rPET is everywhere now.
Yeah.
And there's a reason why it's everywhere, because to reduce contamination, so that when it ends up at your recycling centre, it's easy to recycle and do, because it's horribly costly to separate, and it's problematic if it becomes contaminated and it just goes to landfill or gets, but in Sheffield's case where I live, gets burnt.
It just gets rejected by
Exactly.
by the MRF anyway. But
and then it's not, it's just it's not useful in any way, shape or form. Where that pressure comes from in an environment like yours, it's interesting to know, because we know obviously in food it's come from the consumer and then the retailers and so on and so forth, hasn't it?
And I think this is the gap that we have, isn't it?
Yeah, and it's the gap you have is some form of, there might be a desire to do it, but where is the regulatory pressure or the consumer pressure? But you're not consumers, if that makes sense. Your consumers are under an operation or whatever it may be. You know, they know nothing about the packaging that they're actually working with. How, I guess the question is, can you put some form of regulatory or purchase? When I did some work before, there was talking about, you know, in contracts when you buy things. So when I was working with NHS supply chain a while back, the idea that when you buy something, you stipulate X, Y, Z. Now that's really tricky and it might not exist and all these things.
We're trying.
Exactly, and it is really, but you might say, well, look, it needs to have a minimum. If you think about tethered caps, which are everywhere now, aren't they? That's a legal thing from now. You can't have untethered caps from the end of this year, I don't think. That came from a framework, from a directive, didn't it? Under pressure from people seeing dead birds and things like that and everything else. And now the EU said, but as part of the EU directive, the bit that a lot of people don't realise is the EU directed tethered caps as a thing, and although we're not in the EU, yeah, we need tethered caps are a thing. They also stipulated the amount of recyclable plastic in the bottles and everything else. That was part of the stipulation that's less well known. And then therefore that's driven, the legislation has driven the fact that you're now getting fully recyclable and that plastic. And the other thing is, what happens then is the waste stream needs, so it needs lots of recyclable things. So there is a market for recycled polyethylene. Now, does that make sense?
Yeah,
So
it does, yeah.
you need that market, but it does exist.
I just recently joined NHS from the private sector. I recently work in the private sector, so just recently joined NHS working for North East Ambulance Services. And I can say that the challenge that you face is actually the challenge that I've currently experiencing. So that's why I'm here today. Yeah. So I think one thing I didn't pick up from your presentation, it was a really good presentation, by the way. I think it's sort of like the winning. How do you communicate the winning after you've actually worked and communicated and gained such, gain much of input from the staff? How do you communicate the winning back to the staff? How do you celebrate that? And also, one question is, the waste auditing, is that something that you currently do, and how frequently do you do the auditing, and have you scored? How do you score yourself after you implemented that process so far?
Okay, yeah, so waste auditing we do, obviously every 12 months legal requirement we do anyway, and I do that in conjunction with our technical advisors who come in, our consultancy, but then I tend to do about a monthly audit at different wards, different departments. I'll kind of go around and have I tend to follow the IPC audit schedule, which is it's 1 or 2 wards per month, and I'll kind of tag along with those to do, which it's good to be able to go and do that and see those areas, and they set the schedule, so I'm not kind of biased to it at all. It's an area where I potentially looked at the week prior, or it's something I haven't looked at for 12 months. So it's a really good way to do that. And what was the first part of your question? Sorry, I missed that. Sorry.
Sort of communicating the wins back to the staff.
Oh, okay, yeah. The improvements that we've made in the things.
The improvements, yes.
Yeah. So again, I go on to the weekly meeting that they have at the senior nursing level. So I did that a couple of weeks ago actually, and just gave kind of a 6-month update. 'Cause I don't want to do it every week, but kind of periodically I'll go and do that, which then should get passed down to the staff. And then similarly, I'll get involved on the agenda for the housekeepers and the domestics meetings and the porter meetings, and it essentially gives it the same sort of thing, So if it doesn't, for whatever reason, get passed down to those members of staff, it should then hopefully get picked up when I have a meeting with those members as well from that group of staff. So yeah, it's making sure that I'm still feeding it back, and then what I'm plan on doing is in the next sort of few months look at like a big piece of work in our staff comms, and say, this is what we've done over a 12-month period. We've saved this amount. We've reduced our waste. We've done, and kind of have a bit of a page on that to kind of feed it back to staff really, and kind of say thanks to all those members of staff. So.